very much, Owen. Alan Smeaton is my name. I'm a professor of computing at Dublin City University, where I've been head of school and dean of faculty and a founder of research centres. My area of work is what we call artificial intelligence, though in previous decades working on this topic, it wasn't always called AI. It wasn't fashionable to call it AI, but it's now back in fashion. And I look back on all the stuff I did and I see it rebranded as AI. Two of the current projects I'm working on are, first one is signalling the early detection of an epileptic seizure by a trained assistance dog. The seizure happening in their owner. And then another one is using smart meter data from our smart meters at home to help optimize energy use and find the cheapest tariff. So after a long time in academia with lots, awards and medals and recognitions, I stepped away from DCU last year to enter what's called a new phase. It allows me to have much more control and freedom and to pursue the things which interest me directly. So I'm not gone from DCU, I'm still associated with it, but just they don't pay me anymore. One of the interests I have is that last year I was appointed to the AI Advisory Council, which Owen mentioned, and that has opened many doors to me to allowing me to do events like this. The AI Advisory Council was formed 18 months ago, and we do three things. We give advice to government departments and to agencies when we are asked for advice. So, for example, I have my copy in front of me own as well, the guideline. Never far from these public guidelines. So we would have given feedback on early drafts of this and other departmental guidelines being formulated. We give advice when we are not asked, so we produce our own working papers. And then we also help to demystify AI through events like this. So apart from the projects I work on, as well as trying to keep abreast of the developments in artificial intelligence, which is almost a daily task, this is what I do and who I am.
Thanks very much for that, Alan. Kevin, do you want to give us a little bit of kind of background as to your area of work?
Sure, thanks, Owen. My name is Kevin Kelly. I've been working with the Health Service Executive since 2004, and prior to that had about 14 or 15 years in the private sector. So about 35 years in total working in technology-related roles. I suppose since just before the pandemic, we had stepped into this whole area of automation and specifically robotic process automation. And during the pandemic, we made significant use of that particular technology as part of the pandemic response and established an automation center of excellence in 2020. Since then, I suppose the world has changed somewhat. And we've also developed capability in Power Platform, but more recently with the appointment of a new CTTO in the HSE, we've been asked within that COE to expand our role to now become an AI and automation center of excellence. So there's been significant work over the last 6 to 8 months to understand what that is, and I can talk later on about the work that's been going on, particularly in the last 6 months, around developing an AI strategy and an accompanying implementation framework which sets out how we're going to deliver that strategy. So I suppose I'll leave it at that, on, and we can talk more about all of those subjects.
That's great. Thanks very much for that, Kevin. And Catherine, we have you with us now. Could you give us a little bit of background, I suppose, your area of work over in DAFM?
Hi, my name is Catherine Dempsey. I'm currently heading up the Data Management and Analytics Division within the Department of Agriculture, Food and the Marine. And so part of that job is to formulate a new data strategy for the department. Under my governance, I have 4 units for that go determine how we both collect, use, and manage our data within the department. I've got data management, data infrastructure, data analytics, and then business-specific areas that manage analytics within each of those areas as well. So very much focused on the operational use of analytics and AI to improve our service delivery within the department. We also have responsibility for AI compliance and governance as well, and lending our expertise to that side of the house. But yeah, part of our new stance is to see where we can get benefits where there's lots of backlogs within the department, and if there's any benefit to us with AI in those spaces.
Thanks very much. Thanks to the three again for joining us today. I think it's great to see that we have a mix of experience and hopefully a mix of perspectives as well for the conversation. But suppose just to get into it, kind of to start off, when we were drafting the guidelines last year, I suppose the thing that really made them resonate with the public service audience was the use of actual use cases. I suppose there was a little bit of, we'll speak honestly, that there was a little bit of, I suppose, nervousness about kind of sharing what kind of projects are done with AI out there in the ether. But I suppose as the conversation even developed from kind of Q4 last year up until the start of this year, there was a bit more, I suppose, enthusiasm behind sharing kind of success stories out there. So I suppose, could you give us a bit of flavour, I suppose, particularly, I suppose, Kevin and Catherine working, I suppose, in public service, kind of what projects have you worked on that have used kind of AI in your own organisation? And Alan, if you have anything to this point as well, please feel free. So look, Kevin and Catherine, Catherine, would you like to go first, I suppose, and what it's the specific projects you might be using in DAPM?
Yeah, we have. So we use both traditional and generative AI. So we've kind of, we have different stances. I mean, it's all based on statistical reasoning and probabilities. But in the traditional space, we do a lot of predictive modeling around disease outbreaks and where they may occur, and decision supports for our operational staff on the ground. We have a lot of vets and inspectors who govern compliance over animal health and welfare and preventing disease outbreak. Primarily, a lot of work now is focused on either exotic diseases come into the country or diseases that have been with us a long time, and using different prediction engines to try and figure out, where we're going to focus our resources to prevent those outbreaks and contain them. Any disease outbreak is a stressful event for both the farmer, and the farming family, as they try to, mitigate against both financial loss, but then obviously the stress of not being able to trade or, to work properly on the farm. And then, the financial cost, obviously, for the department as well, and trying to mitigate against that. And, obviously there's compensation for farmers who are going through such an outbreak, which has a cost to ourselves and to the taxpayers. So anything that we can use to stave that off is one of our use cases. So we've used things like clustering algorithms to see where we might see where diseases might move to, or to predict at an animal level where an outbreak might occur during a year cycle. Every animal in Ireland has to be tested for particular diseases like TB. So we can use that information to prevent that stress and that loss on farm. In other areas, we've looked at environmental factors to predict the outbreak, where there might be an outbreak of a foodborne pathogen as well, and contain those, and recommend measures and actions to food producers about how they may mitigate that risk, or actions, the ones that are most effective in preventing an outbreak in the future. So all that kind of preventative work as well. In the Gen AI space, we're just kind of testing out the waters and seeing, what's the best business benefit as well.
Yeah, I suppose a big conversation around generative anyway, as it is separately to kind of other forms of AI as well. But Kevin, I suppose then last was it June, kind of time is flying, I attended the Spark conference as well, where you were speaking on a panel AI with myself, and it was amazing actually to see, I suppose, in the healthcare space, kind of the use of AI that's kind of taking place already out there, and actually to see it kind of communicated and kind of use case examples is really, really impactful to show how kind of AI can be of benefits to our healthcare practitioners. I suppose, especially I really enjoyed that it was part of the conversation, that it was really user-centric, and even picking up what you said, Catherine, there, that you're, I suppose, like, how can we alleviate difficulties on the farming community, and I suppose, in farming families. So it's great to hear that technology has been used with that in mind, but people are still behind your focus when you're looking to use AI. So Kevin, I suppose similarly, kind of in HSE, kind of what are some of the kind of projects that stick out to you, I suppose, or exemplars in using AI in HSE space?
Yeah, I suppose I've mentioned the robotic process automation already, which I suppose is the bottom rung of the AI ladder, but we've made significant use of that over the last 4 to 5 years in the area of infectious disease surveillance and processing of COVID-19 cases, influenza cases, and also RSV. With the Health Protection Surveillance Centre. We've also moved into the Nursing and Midwifery Board of Ireland for the annual obligatory registration of nurses and midwives, and relieved a lot of manual repetitive work on nurse managers in 70 or 80 hospitals now around the country. And then typically they are the typical areas of finance and HR. We've made extensive use of it there, but we've moved on into, suppose, the journey has brought us into intelligent automation, and we're using machine learning for extracting data from or extracting information from structured and unstructured data. And also now beginning to look at agentic AI and agentic automation and how we might use that. We've made some use of process mining in a number of hospitals in the Midlands area to look at how we might better manage appointment scheduling. And also then we've been building agents, I suppose, conversational agents for internal use in areas such as finance and HR as well. I suppose more in terms then of AI, and again referring back to that event at Spark, we heard Peter McMahon talk about. So Peter works in the Mater Hospital, consultant radiologist, and the use they've made of AI in radiology, and we see that in a number of other hospitals as well. And it is one of those key focus areas for us now as we move forward. We've just launched a tender for a national stroke system, which will be AI embedded. And there'll be others, I suppose, arising in that area of radiology. We see Galway are using natural language processing for reading unstructured notes in their kidney disease data system. There's a huge clamour, I suppose, to use ambient scribing, and it's something that will be, again, one of those priority areas that clinicians tell us will relieve huge amounts of time and pressure on them and allow them to become far more patient-facing. We've all had the experience of visiting the clinician or the GP, and they're, you're speaking to them, but you're speaking to the side of their head because they're, furiously trying to capture what you're saying into their system. So that use of ambient scribing allows them to face the patient, and once used in a transparent and an open manner with the patient's consent. This is something that we're actively pursuing now. So there's a huge amount of things happening or bubbling up in this area. We've got a number of projects now passing through the Sláintecare Innovation Fund, I should say. We've got 7 projects that have been approved by Spark Impact, and another 18 which Spark are coordinating through the Consultants Innovation Fund. So that's 25 or 30 AI-related projects, all right across the breadth of healthcare, but all which we'll begin to see some progress on over the next 12 months.
Yeah, and Alan, go ahead.
Yeah, can I throw in some? So in an educational environment, there's lots and lots of uses of generative and of traditional AI or standard AI in doing things like taking teaching content and repurposing for people with autism or whatever it might be. But there's one really nice one we've been doing to address very large class sizes. So we're all on Microsoft Teams, and what's happening is that in the background, Teams is doing a transcript of all of the words that I am saying and all of the words that you're saying and blah blah blah. And if this facility or if the option was enabled, then people could look at the transcript and search through the transcript. And there's 272 people on the call. If you were the 273rd person and you just joined the call, but you are late for whatever reason, and you missed the first 15 or 20 minutes, you could say, what happened? Right? And you could have a summary of that. And you could query, what did Kevin mean by? So we've been using this in large class sizes where the lecturer, looking at a class of 150 or 200 as I was doing, would use Zoom, not Teams, would use Zoom on their phone to record the meeting. So the microphone is on, but the camera is off. And what happens is that link to the meeting is then shared with the rest of the class. And if there's somebody in the class that doesn't understand what the lecturer says, then the last thing they're going to do is put up their paw and say in front of 200 others, excuse me, I didn't understand what you said. So what they can do is they can connect to the meeting, connect to the chat and ask the questions directly. What did Alan mean by linear regression? And have an interaction with the chatbot based on the content so far, and then they can catch up. And it means that the second half of the lecture, they'll actually understand better than if they missed the key points in it. So there's an example. It's just one point example And while it sounds cool and trendy, it addresses a problem. So in each case that Catherine and Kevin and myself talk about successful uses of AI, they're successful when they address and they solve a problem. In this case, in my case, the problem is you're one of 200 students in a C and you don't understand what the lecturer said. This way you can go clickety click and ask directly. So there's an example. And there are lots of other creative examples of the use of generative and traditional AI, which we wouldn't even think of. It just happens.
This is the really kind of leading reason that we like are the the most popular request that we get is for accessibility and how we can use AI, and it's really like individually driven. It's driven by our staff, it's driven by our customers, and it really it's the leading kind of business use that we're investigating as well, and saying how can we make this more accessible, how can we use it as a tool to promote that as well, and which is great because it's user led, and there's then an appetite for integration across the wider the wider staff or the wider customer base, because it's based on their requirements and their needs rather than we'd like to try out a shiny new tool for Gen AI, and that's the way we're leading it. It has to be on request from somebody. It's not just because it's something new and something that's we should try out.
Yeah, look, and that's really valuable as well, and that kind of I suppose ties back to the central ethos of the guidelines themselves, and that they are user led, and any AI solution is done ultimately for the user. I think that I suppose comes out really clearly from the three examples of the areas I suppose that you speak from, and that's a lot of value. And just even Catherine, picking up I suppose on what you were saying there a little bit on that it comes from the prospect of using AI comes from people. It doesn't come from the sake of doing it, I suppose. But then, and I suppose this also touches on, particularly in a public service kind of context as well, and I suppose the risk management, the risk appetite, and kind of I suppose the question I might put out to you, and even Alan as well, I suppose the second half you might pick up on this from AI council perspective. How might we drive, I suppose, kind of balance the drive for innovation in the space of AI with the need for ethical oversight and public trust? So I suppose Catherine, Kevin from working public sector yourselves, and I suppose Alan from AI Council, do you have any kind of perspective or any thoughts on that?
Well, from the operational end, thing of where we're trying to, we're working in a department, we're there to develop supports for the agri-food industry and to ensure, that we produce food that is safe, that we can trade, and that supports our farming families, but also done in compliance with animal health and welfare. What we're doing is we're approaching it on a risks-based system, because one of the the conditions under the AI Act is that where we recognize as a high risk use case, where we're looking at access to public services, which is part of our bread and butter, what we do every day, that we build in controls and systems, and then that we make sure that when we're developing out or using something that has AI in it, that it is done so in an unbiased and in a fair way, and that when we're developing out a project, it has to follow through a series of tests, which people are doing anyway when they're developing out AI products. It's just formalizing it and putting it into a report, and then constantly monitoring it, so making sure that the way that it's predicting some either a disease outbreak, or whether there might be another product that we've developed is to isolate data breaches, so that's in compliance, and it's not doing it unfairly, and we continually test it. So what we've done is we have set up an AI risk assessment council who look at the risk behind each of the products that we're either testing out in a pilot or in a research basis, and they will label it as within the confines of the AI Act at a different risk level, and then weigh that against the benefits. If it's high risk, doesn't mean it can't go ahead. It just means you have to make sure that you're reporting, you're carrying out the tests as you go along, and you're then making those available to the AI Risk Assessment Council. And then at the end, you'll do your data protection impact assessment, your AI impact assessment, and then say, okay, this is the impact, but we've mitigated against these ways, and we're monitoring it constantly as well. And then there will always be somebody, a human in the loop, to make final judgment calls on access, and there will always be somebody to review it at the end. For example, in our data breaches, what happens is if there's a mismatch between two identifiers, or where the wrong identifiers against the wrong name and address, it'll isolate it, but it'll go and tell an officer that they have to check it and make sure that that's okay to either release, or there has been a mistake, and then that needs to be uploaded again. And so what it's doing is protecting our customers, but at the same time, it's smoothing out that process and making it easier for our officers to identify where something has happened.
Yeah, Catherine name dropped that a couple of times. The regulation. I mean, your question was formed, Owen, as the balance between innovation and, on the other hand, ethical oversight and public trust. But I don't think it's two things. I think it's three things. And that third thing is the regulation, the EU AI Act. Some of those provisions are already in place. And what they do is they provide that guidance between free for all, Wild West innovation, anything goes, versus the ethical oversight. And we're guided by the EU AI Act.
Mm-hmm.
Yeah, it's much the same for us on. I suppose, given the nature of our business, we have to adopt a very careful and maybe defensive posture. Whatever regulatory compliance, but patient harm is a huge impact that we have to protect against. So I mentioned earlier on the AI strategy that we've been developing over the last 6 months in collaboration with the Department of Health. And also then, importantly, the implementation framework, which sets out the guardrails for the delivery of the strategy and how AI projects should proceed, and the things that need to be considered in that capacity. So, as part of the governance structure, we're proposing, and we're now in execution mode, where we'll have an oversight group, an AI oversight group. But also then clinical advisory group where necessary, and particularly for high-risk AI solutions as classified in the EU AI Act, a technical advisory group, and also then regional groups. Now, we do intend to have patient representation on the larger and the more high-risk AI projects. And to that effect, we've had patient reps on the journey with us through the development of the AI strategy and also the framework. But I suppose in terms of innovation, we don't want to lose. There's a risk in not pursuing opportunities relating to AI, I should say. We will leave good opportunities behind if we're overly defensive. So we've recently signed, over the last number of months, signed an MOU with Health Tech Ireland. So that gives us access to the industry, if you like, and an engagement with them at the level that is acceptable for ourselves. And also then we're establishing links with academic institutions and maintaining those links with the patient groups, our service users, and the patient advocacy representation groups. So it's trying to find that balance between being careful and being correct in how we govern the use of AI, but also not losing sight of the opportunities that might come because we're innovation averse, if you like. So it's a journey we're on, and just hoping to find that proper tipping point.
But that's what the guidelines did initially for us, is that nobody was doing anything because they were all too afraid to do it. They were just there's no way for me to do it, I'm too scared. I don't know how to develop something without without worrying about like there's a massive risk behind it, or that somebody might be harmed by it, or might get a wrong decision around it. But now this sets out a way for people to develop out or to use AI products in a way that they then know, I've done everything I can to make sure that this is done in a way that puts the customer and my citizens at the heart of it, and I've done everything I can do to make sure that I have mitigated against that and put all that consideration into it as well. And I'm constantly monitoring it then to make sure that it's working in the way that I think it's meant to work.
Yeah. And look, even just picking up on that, what you were saying there, Catherine, a second ago, about people having fear kind of coming into this area and having something, I suppose, then to give them a bit of a grounding in using AI. I suppose then, just to kind of wrap up this kind of section, if you were to kind of give, I suppose, a little bit of advice or lessons learned from using AI and AI pilots to maybe new kind of teams looking to deploy AI in the course of their work, what key lesson might you give, I suppose, to a team looking to start an AI or to deploy AI in the course of their work, if there was something that stuck out to you? in deploying AI?
It has to be a problem that you have.
Yeah.
It has
That's
to be
exactly
something
what I
that
was
you
going to
want to fix. It can't be just here's a shiny new toy, let's give this a go, because then it can be expensive.
Yeah.
You're not going to get buy-in then from senior leadership. There was obviously everyone was very enthusiastic when Gen AI came out, first of all, but it has to be what are our pain points? We have for example, we have a backlog of either applications or we have to review legislation, or we want to give advice out to our customers. How do we quickly scan through something to make sure that we've given them the right answer, and then test that as well? So it has to be a business-led and strategically led rollout of AI. We've been using traditional AI, but now bringing in generative AI as well. It has to have some benefit for some, for a pain point that we want to fix, and that's the way we've approached it. You'll get you might get approached to try something out, but don't try it out just for the sake of trying it out. Try it out because you want to fix something, and because you want to change a process. And then that will be, once people see the value in it, then it removes the fear. If it's a high risk one and you've done all your due diligence, then that fear is removed. If it's low risk, you can get it working pretty quickly, and then everybody will see the benefit. But so focus on the problem.
Thanks, Catherine. Alan, were you coming in with something there?
I was just going to say exactly the same thing. It's the problem first. Find a problem to solve, right? And when you identify the problem, then see if whatever form of AI is the correct fit for that, or the appropriate fit for that. Don't just go around with this hammer looking for something to hit with it, right? Find the nail first.
Very good. And Kevin, do you have anything to add to that section?
Yeah. So look, I'm going last, so everybody's saying everything that I'm thinking. But Catherine mentioned about it being the need for it to be business led. In our world, it must be clinically led. And again, not having a hammer and looking for a nail here. We've seen that where a lack of standards perhaps has kind of led us down a wrong road once or twice, but we've learned from that. And also then just to mention data and the absolute necessity for a very strong data foundation. So again, in our world, we're part of a new office called the Chief Data and Analytics Office, and it's a new word for us all. I mentioned the AI strategy, but there's also a data strategy in draft as well. So, and the two are completely interlinked. So the data that's being ingested by an AI and the data that it's spitting out, we need to be absolutely crystal clear as to and assured as to the quality of that data.
Thanks
Absolutely,
for that,
Kevin. I agree 100%. That we're drafting our data strategy as well, which will be followed by our AI strategy, because we were just like, look at the so people know what quality data is when they see it, or how to make sure that their data is of a sufficient quality. And I keep banging this drum about it's now the time for records management and information management. That the more we curate it or that we classify it, so that then you can use generative AI or agentic AI to handle that data, because it knows what's restricted, what's not, what's public, what's confidential, and that whole piece of curating your data and making sure that your data is of a particular standard is key to this. It's always been key to analytics, but now that you have the possibility of something using data in a really unsupervised way, then you have to do your homework beforehand and make sure that your data is well tagged and categorized and of a sufficient quality.
Thank you. And look, I think that really echoes, I suppose, the guidelines again itself, the essential, the need for quality data to inform any AI solution. And I suppose also as well, I really like that all of you kind of touched on as well, that sometimes using AI isn't the right solution for a problem. To be quite honest, our decision framework does posit that question at the start. Should I use AI? Should AI be used for this solution? And sometimes factually the answer is no, that there may be other digital solutions for your problem out there. So it is important to explore the right solution that would kind of, I suppose, address your problem, like you were saying there. Look, thank you very much. I suppose we're getting onto opportunities kind of with AI, and thank you for sharing kind of your use cases and your own experience in that sense. But I suppose also in the vein of what the Thekla Thekla Talks are all about, I suppose, is to talk honestly and constructively about kind of real issues that have an effect on public service provision and society at large. And as we know, AI, there's a lot of challenges to kind of deploying it kind of successfully and ethically, responsibly as well. So there are lots of questions that have come up around its kind of heightened rollout and its further emergence in its use both in public service and in private sector as well. So let's just kind of, suppose, touch on those things as well. And naturally, we're not going to solve all these problems between us here today, but it's important at least that we talk about them. So I suppose in that sense, how can we as public service organizations, I suppose, strike a balance between using AI and ensuring, I suppose, that these technologies align with long-term environmental sustainability goals? So that is a routine kind of a question that comes up over and over again. So any of the panel have any thoughts on that part?
I'd say Kevin should go first on this one.
I was just about to say
Thanks, Alan. Yeah, I mean, it's a subject that's it's a hot topic around our dinner table at the moment. Although my son, he's in Canada, he's working in the Rockies, and he's a wildlife biologist, but his background's in environmental biology and so on. So. And now he's beginning to use AI, and that conflict is starting to appear for him. And we see it ourselves. I mean, we've been teaching our kids to say please and thank you, but now I'm trying to convince them all at home that every time you do that, you're knocking down a tree, because the AI model now has to figure out what you mean by please and thank you and so on. So it's okay to be blunt and rude when you're speaking to ChatGPT or whatever, but in reality, I suppose, what can we do? Do we go in and buy a jar of coffee that's on brand, or do you buy the fair trade coffee? And it's a choice, I suppose, we have to make. But as public sector organizations, I think we do have the opportunity to push back on our AI suppliers and to see what they're doing in terms of their journey towards net zero, for example. Some of the larger players, we won't name them, but I mean, they all do have environmental policies and so on and so forth. And AI now has to become part of that conversation. And I'm talking from personal opinion here now. If I, as an organization, have a duty, as a public sector organization particularly, around achieving certain carbon levels or certain goals or certain net zero targets or whatever, well, then that I should be pushing that responsibility back down on the people who supply solutions to me, including the AI vendors. So I think that's something that that's in our own hands, and we can have that conversation with our suppliers.
I'm from a technical and as a scientist point of view, I think that what we've seen over the last few years has been a ramp up of the energy demands to fuel artificial intelligence, not just energy demands, but rigid training data demands. And there's two areas where that happens. First is in the training of the models. So this can take 3 or 4 months of compute time on these massive data servers in order to generate a model. And as soon as the model is generated, what do? They start again and generate another model. So there's that aspect, the training of the models. And then the second aspect where energy is used is in the inference, actually interacting with it and having that inference process come back with the answer from ChatGPT or Copilot or Gemini or whatever it might be. I think that there will be a public twist away from these massive models. And they're currently at a stage where the perception is that the model has to be as big as it can possibly be. I think that we've seen that smaller models can be just as effective. And I think we may see that lead to a reduction in the training time requirements. And as for the inference cost, when the Chinese company DeepSeek did what they did earlier this year and were able to reduce the inference time and the energy required to a fraction, then that pointed that ultimately what we'll see is that your son will be interacting with ChatGPT not through a computer or through a tablet, but through his phone, and it will be running natively on his phone. And the technology in this phone is fantastic. The kind of video compression that is built into this device, right, is incredible and very energy efficient. And I would see that the inference cost, which is currently half the cost of using large language models, when it distills down to everybody's phone, maybe it's not this version of the iPhone, maybe it'll be the next version of the iPhone, then what will happen is that those huge big data centers that are required to do inference may not all be needed. So I'm more optimistic. I don't see the curve continuing in this direction. I see it, this is the energy demand curve, and I see it deflecting downwards.
Interesting.
Obviously currently what we can do is make that decision, do we need to use AI or not? I mean, what is the cost and the, for us both on energy, financially, then resource wise for using AI, and to build that into our decision point as well, is if it's a financial cost to us, or there's going to be too much energy expended on it just for everyday use, then possibly we mightn't open it every project up to AI. So what we're doing is we're using it for specific use cases. You can't just turn on ChatGPT for everybody within the whole department, because then the energy costs of that are going to be too high. But if you're using it for, say, in the future, we're going to be using it for document summarization or for a chatbot, that's fine. But you're not able to just fire in, what will I have for dinner tonight, ChatGPT? I'm thinking of having a casserole, and get it to send something back. What you want is for those specific use cases. And then, as Kevin has said, pushing it back into procurement, this has to become possibly a standard for our procurement, is that you build in the sustainability index if you're buying anything to do with ICT, because ICT is going to be one of the biggest users now of energy, and that we push that responsibility back on both the metrics behind it, how much we're actually using, and then the mitigations against it on our suppliers, and show them that it means something to us. By publishing it, we could take those on if you want to publish what our energy usage is. That will, you have to lay it bare. As I said, we want to be controversial. They're the ways that we could take that responsibility and say, this is how much we're using.
Yeah. Well, look, thank you for being honest on that. And look, it is, I suppose, it's a central part of the conversation on using AI, but it's something that we have to talk about. So look, each of you, I suppose, have different perspectives and different backgrounds and different use case of AI and different varying levels, I suppose, of energy consumption. So thank you very much anyway for sharing, I suppose, your perspectives on that. Another area, I suppose, is kind of the area of agentic AI. And I suppose when we published the guidelines for responsible use of AI in the public service this year, a central kind of tenet of the guidelines and the framework is that the responsible use constitutes human oversight and agency, and also human in the loop, which I know Catherine spoke to a little bit about earlier. But there is, I suppose, there has been more recently discussion on using potentially agentic AI in the use of public services elsewhere, not Irish specific, but there has been conversation about using agentic AI. What are your thoughts on potentially using agentic AI in public service provision?
Can I go first on this one?
Certainly, Alan, fire away. Take it.
So first of all, I think it's worth recapping for the audience what we mean by agentic AI. So there's traditional or classic AI, which is the kind of stuff that Catherine mentioned, where you're using data to predict an outcome, right, or to recommend something. That's the AI that's been with us for decades. Then more recently, there's generative AI, which is large language models like ChatGPT or Gemini, where you ask questions and you get answers back, or you get summaries of documents. Agentic AI is a different kind of AI. It's kind of an evolution of the previous ones, where we've got a software program, which does something, and it does just that thing. And we've got another program that does something else, and another program that does something else. And the programs can talk to each other. So, for example, here's a program that can search the web. Here's a program that can download web pages. Here's a program that can summarize web pages. Here's another program that can do something else. And with agentic AI, what you do is you say, okay, you 4 programs here, solve a problem, sort it out among yourselves, and tell me when you come up with the answer, right? Which is kind of conflicting with the guidelines about human oversight. But that's what agents and agentic software and agentic AI is. It's basically having small programs which do only one thing, and they do it very well, and they don't do anything else, but they talk to other programs who do bits and pieces. And as the 276 people on the call are looking at this, think of what you do in your day-to-day things. You do processes. You know, you might read an email, then do a response, then submit this document, then do something else and something else. Agentic AI purports to take individual tasks that we do and string them together in an overall orchestration. A very good example of this is the advanced searching that ChatGPT, Gemini, Copilot, and Perplexity currently allow us to do. This is your moment, Emer. If you can plop this into the chat. So here's something I baked earlier. So if you have, and do this in your own time and outside of your work environment, if you have a personal account with ChatGPT or with Copilot or Gemini or one called Perplexity, then go there after this call. Don't go yet, because then you won't be listening to us. Go there after this call and then choose the option which is different for each of these systems. So in ChatGPT, it's called Deep Research. In Gemini, it's called Deep Research. In Copilot, it's called Think Deeper. And in Perplexity, it's called Research. And what this does is it says, this isn't a search with a question and an answer. It's a search where it's going to go off and think about it and have an agent that does web search and have an agent that does downloading of documents and have an agent that has about 5 or 6 different agents. So what you do is you put in a query, which is not a yes, no, or a simple answer one. An example of this is that I wanted to find out what are the total profits by all of the domestic electricity companies in Ireland in 2024. And that's not a piece of information that's in one place. For that, you got to go to Electric Ireland, you got to go to Flowgas, you got to go to Bord Gáis Energy, you got to go to all of them. There's about 10 of them. And you got to go to each one of them and find out by searching through lots and lots of documents what the profits are for each one of those, and then give me a single answer. Now, I did this with each of those 4 systems, and they came back with 4 different answers. Right? Because they hallucinate and they don't always get things right. Gemini came back and said it's complex because of the nuanced way that they do financial reporting. ChatGPT said it's 1.18 billion, but they identified 6 companies. One of them was EirGrid, who isn't a domestic energy supplier at all. Perplexity said it's 1.03 billion. They identified 4 companies, and Copilot said it was another number again. So what happens with these systems is that you give it a question like that and you sit back and you watch, and it feeds on screen what it is doing, and you can see all of the different agents doing things. I'm searching this website, I'm summarizing this document, I've downloaded this, I'm doing this. So you're almost like watching the screen unfold. Sometimes with one of these systems, it came back in 10 minutes. And that's fine. I can afford 10 minutes time watching somebody else, these agents doing these. And another one might come back in, 2 minutes, that kind of thing. But that's a flavor of what agentic AI is, but just for the task of searching. So my advice or encouragement would be for people to do this in your own time after the call and see what agentic AI could look like, albeit a very restricted application of this. That's what agentic AI can offer.
Thank you very much for that, and I think that was really valuable. Kevin, do you have anything, I suppose, from HSE perspective?
Oh, and yeah, I mentioned it earlier on. We're doing a very limited and a sort of a controlled dip your toe sort of an exercise on agentic automation, where we're going to combine agents with RPA bots. But it's in a very controlled setting within, the collection of data from HR forms. I'd have concerns about it being used where there's clinical summarization, for example, or the risk of patient harm or bias or whatever. So I'm still on the fence on it, Owen, in its use in our particular environment. But we'll continue to look at it, and I guess these things will get better over time. But for now, I'm treading very carefully, and we're treading very carefully in this space.
Would it be fair to say, Kevin? Would it be fair to say, Kevin, that you're looking at it because it might be innovative, but you don't? You'd rather be dipping your toe in it and playing with it and knowing a bit about it rather than just blanking it completely.
Oh, absolutely. Yeah.
That's
I mean, there's
exactly
such
the right
chatter
way.
about it, and it's even to understand what it is,
Yeah.
and how it will change what we do or what we've been doing up to now. What's the impact of it? Is there a benefit? And again, going back to Catherine, is there a use case for it? What pressure will it alleviate in the system? But can we trust it? Do we need, is it something that we will continue to need human oversight on? We need to understand it a lot more before we would step into it a little bit more bravely.
Yeah, it's also very, you need to be wary about it because it's so recent. Like 12 months ago, Agentic AI was a pipe dream. And now we have big tech companies, sorry if there's anyone on the call here, that's their great push now, is to do Agentic AI. And you see big companies like Amazon and the big four consulting firms not taking on as many apprenticeships now because they will be using Agentic AI. They're pushing it. Hang on a second, this wasn't a thing 12 months ago, and already you're making employment decisions of it. So you need to tread very, very carefully and dabble with it and watch it and be aware of it, but don't commit to it, would be my view. And I think that's what Kevin is saying as well.
Yeah.
The same for us. I mean, the human in the loop is, there's nuances and careful consideration that has to happen within a particular case, and lived experience as well, so that you can understand where somebody is coming from within, from a certain perspective, when you're doing a judgment on a particular case. Now, there is benefits for automating certain parts of it, but there will always have to be somebody to evaluate it and make sure that whatever we're making a decision on will is correct. So what a lot of the time we're concentrating on now is how do we evaluate the output from both Gen AI, or if you have a series of agent decisions, and how do we set up an AI evaluation framework, so that we can then test it, both either using AI to test AI, or where you have a human qualified who is looking at the output and saying, yes, you can have some comparison to a gold standard, where you have something that was drafted by a human that has done a lot of research, and then compared to what's outputted by the Gen AI, but with an expert, and say, yes, we can trust this. So when we go back in, we'll test it every now and again, regularly, to make sure that the output is correct, or, as we go on, very carefully and really closely monitored in the first instance. And then as we move through it and we gain its trust, we can probably automate a little bit of the testing, but then every now and again we'll have to have a human go in and check that output as well. If it's something that's making a final decision, there will always be a human to say, yes, that decision is correct, or that decision is not correct. So, but for the agents, what we're looking for is just the possibilities at the moment. We are, where you string together a couple of jobs where you might have, especially in things like, with coding or internet coding, that's where our benefit is going to be, because it's a huge cost to the department. But that's where we might have it. But then you do have to balance that with a loss of skills in those areas as well. So you'd still have to have somebody who's an expert to test the code that's coming along as well. And so you could write a code, unit test it, and then produce something at the end. But then you'd have to really test it that, what it's coding for would be of real benefit. So in those, that's where we kind of see the most benefit for at the moment. So we're just, as I said, having a look and seeing what's out there, and then, but proceeding very carefully and using those monitoring and evaluation frameworks to test output from it.
Yeah. That's really valuable. Look, and I think even that point raised a lot of different perspectives on the use of Agentic AI. And even Kevin, I know you said, I suppose you were treading carefully, but I think you can really see that it's not being overly defensive about the potential use of it kind of prior to going into it and endeavouring to actually deploy it, which really, really resonated from what you were saying earlier, and equally, Catherine, as well, actually having a use case for it, which I suppose is carried on from earlier on in the conversation, that the right solution for the right problem, and AI or Agentic AI might not be, potentially. It's just to decide whether it is or not. I suppose then equally, as I said, the guidelines were human in the loop, human oversight, but Agentic AI isn't necessarily contradictory to that as well. If anything, I suppose it amplifies the need maybe for a little more oversight or human in the loop, which is really, really crucial as well. But I suppose we're nearing the end, but there was kind of another area just even briefly to touch on. I know we went a few minutes, start a few minutes late earlier on, so please forgive if we just run over by about 5 minutes. There's also a lot of discussion, I suppose, as potential impact of AI and kind of people's roles, should I say, as well, and how it might change the nature of our ways of working, and that's a big kind of area of conversation as well. And I suppose, what might you say to kind of people who might be a little bit about fearful potentially, or a little bit nervous even about AI in the workplace and what it might mean for them and kind of how they work, or maybe changes to their roles? What might you say to those people, folks?
So I was thinking about this, and I did an internet search, as you do, how a role is going to change with AI, just to do my own research around it. And, as sort of like primarily from data science, I was like, am I the first to go with it? Since we'll have like AI data scientists. But I think it's just like any industrial revolution. This is a technological revolution. At the beginning of the industrial revolution, there was a change in roles as people moved from the mechanization of jobs, and I was reading a historical article taken from sort of hand weavers perspectives when there was moved to the creation of the loom, and how their jobs were going to disappear and it was going to be affected. And obviously with that change in industry, it just meant there was more employment for lots of different people. Now, the one thing that does hold true is that some of the manual jobs that may change in both the Industrial Revolution and historically were associated with women. So that may be one of the things. If it is manual tasks, now it can change, that a lot of those, we have to just be sensitive to if there's certain sections of a society that might be more affected than other sections of society. So that's maybe the main guardrail. I just don't think there's going to be a loss of any employment, because as we move through history, generally we've just managed to have more people and more jobs going forward. So I just, there will be more different types of employment, but I don't see it decreasing any of those. It's just like another tool. It's like a calculator or a computer. When a computer arrived, we were all saying, well, none of us will be out of a job, the computer will do the job, and that didn't happen. So, I'm very optimistic about how it will improve our workplaces, but just to be mindful that there may be certain sections that might be affected more than others.
Yeah, just to echo that, Catherine, I mean, we have lived experience of it over the last number of years. Any solution where we've, and talking about specifically about automation here first, where we've gone in to automate a solution, we've been brought in by the team themselves. Invariably, wherever we've gone, they've come back and looked for more. They begin to see, so we co-design, we build the automated solution, we give the team a virtual agent or a virtual assistant, we give it a name, and they refer to the robot by name. But the robot is now doing work overnight and cleaning up a lot of work that would have required manual effort, so that it's there for the team the following morning. And I'm talking about, it ranges from clerical officers to surveillance scientists to medical consultants. They've all now got the same experience, where they've been relieved of this mundane, tiresome, energy sapping work. They've been released from that. They have a tool that now does that. It's like your calculator, like your Excel, but now this entity, this Martha in the corner, is going to have this work done overnight, and it'll be there in my inbox tomorrow morning when I come in. So so people are beginning to see that this is a way for them to augment what they do. It makes them better at their jobs. It allows them to be more productive, and it releases them to do higher value and more interesting work. I suppose that will hold for AI as well, in that it's an augmentation of your own skill set, of your own experience. It's you applying your knowledge to get the AI solution to work in the way that you want it to work. So we're not seeing, that there have been no job losses from the work that we've done over the last while, and it's not even a mention of it, but this is simply to allow us to do maybe more with the same. In many cases, we're not getting more staff. So we need to find ways to do more work faster, quicker, more accurately, more efficiently, and AI and automation is a route to allow us to do that, but not at the absolutely. There will be a change in the nature of work, and already where we've automated, people's jobs have slightly changed, but it means that they're doing more enjoyable work, and we've had that firsthand accounts of that, and they call us back in to do more and more of that type of automation that releases them even further to make them more productive. So that's sort of our account of it from what we've seen over the last number of years.
Yeah, we use the term disruption when we look at the impact of AI, and disruption is a negative connotation associated. Disruption is not a good thing, but unfortunately that's the term that is being used, especially on the employment and the jobs front. When every form of disruption, there's a period of uncertainty, and we're just coming out of that period of uncertainty now when it comes to AI. And I'd agree with the previous two speakers in that it may indirectly change your work, because it gives you the opportunity to re-engineer the workflows in your day-to-day things. And unfortunately, that's called AI disruption or displacement, which is also a negative word, but it's an uplift or a chance to augment. And AI cannot completely automate any of the tasks which require decision making that we would normally make, where the task requires aspects like justification or explanation or transparency. And it can help with some of our tasks, but it cannot replace our jobs, because it helps with our activities and it doesn't replace our roles. And one of the things I like to take comfort from is that each of us have an intelligence and a creativity built on decades of experience, and we have an interplay of our ideas and thoughts. And when we get a problem landing on our desktop, we draw solutions from our memories and our experiences and our empathies and our emotions, and you simply can't get that with the large language model or with any form of artificial intelligence. We can get it to mimic our output, but we cannot replace the thought processes that people come up with based on those characteristics that make humans different from AI. So I take great comfort from this kind of aspect, that it will not replace. It may help me with some of my tasks. It may semi-automate some of my tasks. It may even take some of those tasks away from me altogether, in which case, as Kevin says, great.
Thank you. Look, that's incredibly valuable. I think there's a lot of rich experience there. I suppose that's showing from your own experience with your own teams as to how it might change roles, but not, I suppose, doesn't necessarily mean negative impact. It can just mean a change in role, as like Kevin said, to a more higher value, or I suppose where human judgment, I suppose, might be more, I suppose, of value and might be needed more so. So look, I'm really conscious of time, and look, a number of questions have already been touched on even throughout the conversation as well, but there's one here, I suppose, that sticks out to me, and I suppose it feeds into our early, just to get to one, I suppose, from our early conversation as to kind of using AI in the workplace and kind of putting together a business case for it. So from your experience about using AI, I suppose, in your work, what kind of parameters do you use to justify the business case to actually use AI? If you could just expand that a little bit more, maybe Catherine, if you could take that one, I suppose, just before we kind of wrap up.
So the first thing it has to address is like the Department of Agriculture, Food and the Marine has specific strategic goals to support our agri-food industry. It has to address those. It has to be part of the business focus and the vision that we have for our farming communities. Then obviously cost and finance is going to be part of it, and the resourcing and how many people are going to use it, what benefit is it going to be. These are the things that we look at, like with any project, what is the ultimate benefit, and at the end of it, what good does it do for the citizen at the end of it. So that's the sort of key deciding factors that we will have. Is it going to save money? Is it going to save time? Is it mean that there's going to be better outcomes for animal health and welfare? Are we going to prevent a disease outbreak? What is our business benefit? And that's our kind of our problem statement. Is the first thing that we look at is what is the problem, and how can we solve it? And then we're now building in the decision matrix, thanks Owen, into our deciding whether to use AI or not. So is AI going to change it? How long would it take to build it? how many people are you using currently to solve this problem? You know, if you're using 10 or more, then, you know, obviously it's going to have a business benefit, and really slowing down, you can't get grapple on all the data. Maybe you need to automatically clean all the data so that you can surface something that you can give out to your inspectors, or for example, in plant health, you know, can you identify where there might be an outbreak of a particular plant disease, and that we can send people off? Or if somebody sends in a photograph of a diseased plant, you know, can we then identify, yes, this is a risky plant, and, you know, do that based on judgments, and then make a decision to send, you need to have a look at this, alert an officer saying you need to have a look at this, and just review it to see, yes, it is something that we need to look at. So the problem statement is the leading one about why we would employ AI in any business case, you know. And as I said, the solution isn't determined until we've seen the problem. So that's how we lead it. And, you know, how do we ensure that, you know, you're getting business benefit? There has to be metrics around it, and key success metrics for what the solution is meant to be doing. Is it doing that? If it's not doing it, then we're not going to use it. If it is, then, you know, can you demonstrate the benefit to us so that we can then justify, yes, we went out for AI, it's going to save this much time, it's going to save this much cost. It's something for us.
Thank you. Look, that was, I know we're kind of coming up to, I suppose, to time, but that was really, really valuable. I'm sorry we couldn't get to any more kind of questions anyway, but just, I suppose, a bit of flavour about the questions that are still being asked. There's a lot about sensitive data protection in this realm, and I suppose a few questions, I suppose, the purpose of conversational agents as well. So it just kind of gives you a flavour as kind of where people are with their thinking on it. But regardless of that, I hope the conversations at least, I suppose, distilled kind of some of the opportunities, and maybe even demystified a lot of the challenges, and I suppose some of the worries and fears about potentially using AI. But I think this conversation could easily go on for hours and hours between the four of us here. There's no question about it. I just, before we wrap up, just to thank the three of you sincerely. Thank you very much for your time, to Alan, Kevin, and Catherine. It was really, really valuable, and I hope it goes a long way to kind of showing the value of potentially using AI responsibly in the course of better public services and service provision in Ireland more broadly. And equally, thank you to all our attendees who joined us today. I think even for myself, working in public service transformation, it is a really exciting time to work in public service in the public sector in Ireland, especially, I suppose, the emergence of new technologies. But I suppose it just feels that there are still many unknowns. But if we just, I suppose, use opportunities like this today to share expertise and experiences, and go a long way, I suppose, to bring people on the journey with us, that it is a journey that's worthwhile pursuing, and ultimately it's one that is focused on the human, regardless of whether it is an emerging technology or something that's unknown. We always keep the end user or the human at the centre, and that was really, really reverberated very well, particularly with Kevin, what you're saying with patients, and Catherine, with you with the farming community and farming families throughout Ireland as well. There's loads that was brought up today. I think that I was frantically jotting down notes here. I mean, like, not using AI for the sake of it, that's really, really valuable. And equally as well, Kevin, not to be overly defensive, which I know in public sector and in the public service we can be, because we want to manage risk and have an appropriate risk appetite. But there's a lot of good here, and look, transformation is a conversation, so it's important that we at least just keep talking. So on that, I'd just like to thank you all once again. Thank you for your time, and thank you for engaging with us. Take care. Bye, everyone.
Bye. Thanks
Thank
all.
you. So bye-bye now.
Bye-bye. Bye-bye.